you had one of these substandard plans before the Affordable Care Act became law, and you really liked that plan, you were able to keep it. That's what I said when I was running for office. That was part of the promise we made.
Here's my letter. This is the letter that my family got canceling our insurance. We chose to have our own private policy back in Colorado so we could be in the same boat as every one of my constituents. And yet my insurance policy has been canceled.
Some people like to drive a Ford, not a Ferrari, and some people like to drink out of a red Solo cup, not a crystal stem. You're taking away their choice. Before, during, and after the law was passed, the president kept saying, if you like your health care plan, you can keep it. So is he keeping his promise?
Yes, he is.
The Washington Post gave the administration and the president, yourself, 4 Pinocchios on this whole debate of if you like the insurance you have, you can keep it.
So if you're getting one of these letters, just shop around in the new marketplace. That's what it's for.
Just shop around. Really? That after President Obama promised you could keep your plan. And today, Republican Senator Ron Johnson introducing a new bill forcing the president to keep his promise. Senator Johnson from the great state of Wisconsin joins us. Nice to see you, Senator.
Hello, Greta.
Okay, so your bill, what is your bill that you've introduced?
Well, it's a true grandfather clause. It actually will allow President Obama to keep that promise that he made to millions of Americans. We can't protect them all. The only way we can honor that promise for every American is to repeal the health care law. But for millions of Americans, they actually would be able to keep the health care plan that they actually like. We would give them that freedom that President Obama and the health care law is taking away from millions of Americans.
2 problems. One is that those plans that a lot of people want to so-called keep, they don't exist anymore. The insurance companies are just, booting them out, so they don't. So you really can't have the plan that you want if it's gone.
They could reintroduce those easily.
Well, but you can't force the insurance companies to offer them again, right? You agree with that?
No, but they certainly would. The marketplace would certainly allow that because part of the problem with those new plans have additional mandates, so their cost is being driven up, which was the other promise in terms of bending the cost curve down. That also was a broken promise by this president.
The other problem for some Americans is I took a look at a couple of them. They're really junk policies. In fact, I'm surprised that the state attorney generals aren't going after some of these insurance companies for selling this absolute junk, which they sold absolutely nothing to some people. No hospitalization. I mean, it's obscene what some of these policies are.
You know why really prompted me to drop this now? There was a couple in Wisconsin, both suffering from cancer. She has stage 4 lung cancer. They got dropped from the high-risk pool, which actually works. Their exposure is basically doubling. From $20,000 to $40,000, maybe the government will pick up about $10,000 of that. They're in a panic. And let's face it, stress is not good when you have cancer. And this president, I heard Kathleen Sebelius say that people are benefiting from health care security now. No, this is gross insecurity.
All right, well, even she got hit with that with Congressman Rogers cross-examined her pretty heavily on that. All right, interesting about it is Senator Mary Landrieu has a policy, as a bill very similar to yours that she wants it, but she's also said that she's considering voting for yours. She's a Democrat. That's a switch.
Well, what my bill does, it actually uses President Obama's grandfathering language in his bill, just removes the exceptions. And so it actually does allow people like Mary Landrieu to help President Obama keep that promise. There's no reason for every Democrat not to sign my bill.
Let me ask you a question. Where are we getting the money for this bill? I mean, it's like, everyone's complaining about the website, but we have a real funding issue. If we're getting waivers, extensions, young people aren't going to buy it. And where are we getting the money for this?
Basically borrowing from our kids and grandkids. I mean, in the current budget window, Obamacare costs about $2.5 trillion. I think taxes, fees, and penalties and other taxes are going to be about $1 trillion. There's a $1.5 trillion deficit question mark right now. Is that coming out of Medicare? No, this is utterly unsustainable. Over 30 years, we estimated health care law costs about $13 trillion, Greta.
Well,
we can't afford it.
I'm one of those people, I truly believe we've got to get medical care to everybody, but I'm trying to figure out where the money is coming from. So that's my, concern about. But anyway, we'll see what happens, and we'll see what happens to your bill. And if you get more Democratic support besides Senator Mary Landrieu.
I'm optimistic that we can actually pass this thing and honor that promise that President Obama made to millions of Americans.
Senator, thank you. Packers will win this weekend, right?
Absolutely.